Start. Welcome back guys. Now in this video we will be discussing about the topic of murmurs. Okay. Now first of all look at this diagram. See, this diagram is called as a phonocardiogram. Okay. We call it as a phonocardiogram. See, in this phonocardiogram here I am dividing it into two phases mainly. You can see this a dotted line. Okay. In between these two dotted lines there is a phase where I am showing light blue color. Okay, you can see this light bluish color area. So what is this area? See, this is systole. Okay, this area which I am highlighting in between these two dotted lines, this is called as a systole. And the area which I am highlighting here in the light green color, okay, this area is the diastole, and again I am showing you the systole. So systole followed by diastole. Now you might be thinking, sir, how I can say the first phase is the systole? Okay, what is the proof? Look at the ECG. I have already told you from the beginning, or I should say from the middle of the R wave. You know, this is the R wave, right? Okay, this is the R wave. From the middle of the R wave to the end of the T wave. What is this phase called as? This is called as the systole. Already I have explained you that in the previous videos. So from the middle of the R wave to the end of the T wave is the systole. And diastole is from end of the T wave to one more R, to one more middle of the R, that is the diastole, okay, which contains the 5 subphases of the diastole. So this phase is systole and here this green color phase is the diastole. One more proof. Have I already taught you? Systole is a phase between which two heart sounds? The phase between S1 and S2 heart sounds is the systole, and the phase between S2 and one more S1 is the diastole. Okay, done. Now let's divide the murmurs into two types. Okay, mainly the murmurs which can happen during the systole, they are called as the systolic murmurs, and the murmurs which can happen during the diastole, they are called as the diastolic murmurs. Now look at the first type of murmur, this one. Okay, now you tell me, this first murmur means, you know, abnormal sound. So this first murmur, where is it happening? Is it happening during systole or diastole? Yes, it is happening during systole. But any murmur is happening during diastole? No. Again the murmur is coming during the phase of the systole. So this murmur is definitely a systolic murmur. And that too, the murmur is happening from the beginning of the systole to the end of the systole. So we call it as a pan-systolic murmur. And the murmur intensity, the sound of the murmur is also same. Okay, it is not increasing and decreasing. The intensity, the sound intensity is continuous throughout the systole. So that's why these murmurs are called as holosystolic or pan-systolic murmurs. Holosystolic murmurs are pan-systolic murmur. Holo means throughout, or pan means also throughout systole murmur. Now you might be thinking, sir, where do we see such holosystolic murmurs or pan-systolic murmurs? Okay, holosystolic murmurs or pan-systolic murmurs are seen in which conditions? See, I will tell you three conditions. These are the only three conditions where you can have the holosystolic murmurs or pan-systolic murmurs. They are MR, mitral regurgitation, tricuspid regurgitation, and ventricular septal defect. MR, TR, VSD you can say, in short form MR, TR and VSD, just remember like that. MR, TR, VSD, mitral regurgitation, tricuspid regurgitation, ventricular septal defect, these are the conditions where you can have the holosystolic murmurs or pan-systolic murmurs. Now you will be having a doubt, why mitral regurgitation is going to cause a systolic murmur, that too pan-systolic murmur, okay? Why not the diastolic murmur? Now let me explain you that, okay? Look at this diagram. Here I am showing you heart with the 4 chambers, okay? Let's say here, this is a 4-chambered heart. Now, which valvular abnormalities are we having? Guys, we are having problem here, that is the mitral valve is not closing properly and the tricuspid valve is also not closing properly. The valve leaflets, they are not closing properly. So you tell me, whenever they are not closing properly, what will happen? See, during the systole, that is during isovolumetric contraction, rapid ejection phase and slow ejection phase. Okay, isovolumetry contraction, rapid ejection phase and slow ejection phase. During all these phases, okay, the blood which was supposed to go into aorta and pulmonary artery, okay, normally the blood has to go like this, okay, the blood has to go either into the pulmonary circulation or into the systemic circulation. But now as these valves are not closing properly, what do you think will happen? The blood will start to regurgitate back. Now as the blood is regurgitating back unnecessarily, that is going to cause the murmur. Okay, that is going to cause the murmur. In which phase? The murmur is going to happen even during isovolumetry contraction, rapid ejection phase and slow ejection phase. In all these phases, the blood is regurgitating back. So there is going to be a pan-systolic murmur in MR and TR. Okay, mitral regurgitation, tricuspid regurgitation is going to present with the pan-systolic murmur. Now, MR, TR completed, okay, MR and TR. Then, what about the ventricular septal defect? Look at here. You know, ventricular septal defects are one of the most common congenital heart anomalies. Okay, the most common congenital heart disorders are the ventricular septal defects. Okay, and where this defect present is also very much important. Where this defect is it present in the muscular part of the septum or is it present in the membranous part of the septum? Okay, that's also very important for your exam, but I am not going to that. You tell me, whenever there is a ventricular septal defect, okay, here there is a orifice, let's say. Now, what do you think will happen? The blood is going to go from left side to right side. That is from the beginning of the systole, that is isovolumetry contraction followed by rapid ejection phase and slow ejection phases. During all these phases, the blood is going to regurgitate from left to right. From left to right. Now, you will be having it out. Why the blood is shunting? You can say it is a left to right shunt. Why the blood is shunting from left to right but not right to left? Why there is no right to left shunt? See, that is because of the pressure difference. Always remember, the pressures that are generated by the left ventricle are always higher when compared to the right side. Okay, maybe right ventricle is generating a pressure of 25 mmHg, but left ventricle generates a higher pressure, guys, almost 120 mmHg during systole. So always the blood is going to go from left side of the heart to right side because of the pressure difference. Now you will be having it out why right side of the heart is generating a lesser pressure, just let's say 25 mmHg. Right side of the heart is generating a pressure of 120 mmHg. Why this pressure difference? Is because the left sided heart, okay, the left ventricle has to push the blood into the entire systemic circulation, okay, into the aorta, into all the arteries. Okay, it's very hard, so it has to generate more pressure because the left ventricle have to pump the blood to the entire body, so it has to generate higher pressure. But what about the right ventricle? Right ventricle is generating less pressure because it have to send the blood to the lungs. You see here, this is the place where there is a heart and just beside them there are lungs, okay, just side to them there are lungs. So it is not a big deal to pump the blood to the lungs. So less pressure is needed, okay, no need of higher pressures. So that is the reason why right ventricle generates less pressure, left ventricle generates more pressure. Okay, so now you know during isovolumetry contraction, rapid ejection phase, slow ejection phase, and during all these phases, there is going to be shunting of the blood, and the shunting of the blood is going to create a pan-systolic murmur again. Okay, pan-systolic murmur. So finally, conclude. What are the three conditions where there is going to be pan-systolic murmur or holosystolic murmur? Okay, MR, TR, VST. Now, look at the second murmur. Okay, now look at here. See, again here, the murmur is happening during the phase of systole. Definitely, without any doubt, again the murmur is happening during the phase of systole. That too, the murmur is there from the beginning of the systole to the end of the systole. It is throughout the systole. So, why can't I call it as a pan-systolic murmur? It's also there, no? Yes, of course, it's a pan-systolic. It is there from the beginning of the systole to the end of the systole. But what is the difference is, see, the intensity of the murmur is increasing, the murmur sound is increasing later the murmur intensity is decreasing. Okay, so murmur intensity is increasing, later decreasing. So that's why it is called as a crescendo decrescendo murmur. Okay, so crescendo decrescendo murmur. So what is the shape of this murmur? It is looking like almost like a diamond. Okay, the murmur is looking like a shape of the diamond. So that's why it is also called as a diamond shaped murmur. Okay, crescendo decrescendo murmur or diamond shaped murmur. Now in your books, the same murmur is also called with a different name. Okay, so don't confuse. It is also called as ejection, systolic murmur. Okay, ejection, systolic murmur. And where do we see such ejection systolic murmurs? Okay, ejection systolic murmur, the crescendo decrescendo murmur. They are seen with aortic stenosis, pulmonic stenosis and HOCM. Aortic stenosis, pulmonic stenosis and HOCM. What is HOCM? HOCM stands for hypertrophic obstructive cardiomyopathy. Okay, hypertrophic obstructive cardiomyopathy. In this condition, again there is going to be a crescendo decrescendo murmur. Okay, now you will be having a doubt, sir, why in these conditions aortic stenosis and pulmonic stenosis the murmur is going to be crescendo decrescendo murmur? I will give you a simple example. Okay, you can remember it like this. Okay, the easiest way to remember. Guys, look at here. This is the left ventricle I am showing. Okay, here is the left ventricle I am showing. And what is this wall? Definitely then this wall is going to be the aortic wall. Now in this condition, what happened to the aortic wall? The aortic wall got stenosed. Okay, there is stenosis of the aortic wall. Okay, there is stenosis of this aortic wall. So now you tell me one thing, whenever there is a stenosis of this wall, okay, in order to open this wall, you have to generate more pressure or less pressure? You have to generate more pressure. So what happens is, the left ventricle will start to generate more pressure. As more pressure is being generated, tell me what will happen? So more blood will start to go out. Okay, more blood will start to go out. As more blood is going, okay, initially as more blood is going, so there is going to be more sound, more murmur is going to happen in the beginning. Okay, later what will happen? The amount of pressure generated by the left ventricle will start to fall. Okay, as the valve is open, the amount of pressure that is generated by the left ventricle will start to fall. So less blood is going to go. Okay, less blood is going to go. So automatically the murmur intensity also decreases. Okay, we all know. Okay, during the cardiac cycle, initially the left ventricle will start to generate more pressure. As more pressure is getting generated, more blood will go, leading to more murmur. Later, during the slow ejection phase, we know the pressures are going to decline. As the pressures are decreasing, less amount of blood will start to go, so there is going to be a less murmur. So initially there is going to be more intensity murmur followed by less intensity murmur. That is called as a crescendo decrescendo murmur or ejection systolic murmur. Seen in aortic stenosis, exactly opposite pulmonic stenosis, and hypertrophic obstructive cardiomyopathy. Because hypertrophic obstructive cardiomyopathy, what is this obstruction? This obstruction is nothing but the subaortic stenosis. Okay. So in these three conditions, there is going to be crescendo decrescendo murmur. So now let us discuss about this third murmur. Okay, this murmur. So tell me, guys, the murmur which I am showing you here. Okay, see this murmur, is it happening during the phase of systole or is it happening during the phase of diastole? Tell me first. Yes, definitely this murmur is falling under the phase of diastole. So is it systolic murmur or diastolic murmur? Definitely it's a diastolic murmur. That too, look carefully. This murmur is happening in the early phase of the diastole. So it is early diastolic murmur. Not only that, let me give you more information. The murmur intensity is not rising but declining. Okay, so it is declining. So it's a early decrescendo diastolic murmur. Okay, so right here it is early decrescendo diastolic murmur. So students, tell me, where do you see such decrescendo diastolic murmurs? Okay, early decrescendo diastolic murmur. If you see this word, early decrescendo diastolic murmur, immediately you should have some diagnosis in your mind. Okay, where do we see such early decrescendo diastolic murmurs? They are seen with conditions like aortic regurgitation, and pulmonic regurgitation. Okay. Now let me give you an example why the murmur is seen during the phase of diastole. Okay. You look at here, guys. Let's say this is the left ventricle. Okay. Here I am showing you the left ventricle, and today the problem is with the aortic valve. What is the problem? The aortic valve today is not closing properly. Okay. The aortic valve was supposed to open during the phase of systole. Okay, whenever the heart is contracting, whenever the left ventricle is contracting, the aortic valve is supposed to open and the blood has to go. That is normal. But during the phase of diastole, you tell me, the aortic valve was supposed to be totally in closed state. But what is happening now? The aortic valve leaflets, they are inflamed, and let's say they are not closing properly. Maybe the patient is having acute rheumatic fever. As these valve leaflets are not closing properly, there is a chance, okay, there is a chance the blood can come back during the phase of diastole. Why? We know during the phase of diastole, the pressure here in the left ventricle is decreasing. The ventricle is not contracting. Diastole means relaxation. The ventricle is relaxing and the pressures are falling in the ventricle. There are less pressures. So definitely there is a chance the blood can come back to the low pressure. Already here in the aorta there is high pressure. From high pressure there is a chance the blood can go back into the low pressure area. So now tell me, aortic regurgitation, that is aortic valve regurgitation, is going to cause a murmur during the phase of diastole. Okay. So in the beginning you tell me, as there is very high pressure here, lot of blood will start to come. Okay, lot of blood will start to come back into the ventricle. So there is going to be high intensity sound. So as more blood is coming back, initially there is going to be more sound coming. As the amount of blood is declining, as the amount of regurgitant blood that is declining, the murmur intensity also declines. Okay. So there is going to be early decrescendo diastolic murmur. Early decrescendo diastolic murmur. That is going to be seen with the aortic regurgitation as well as same with the pulmonic regurgitation also. Okay. Next, look at this fourth murmur. See this fourth murmur, you tell me, where is it present? Where is it located? Is it a systolic murmur or diastolic murmur? The murmur is going to be seen during the phase of systole. Okay, the murmur is seen during the phase of systole as well as during the diastole also. Okay, there is going to be peak, the murmur peak is going to be there between the systole and diastole. Okay, that is one thing which I want you to know, where the high intensity murmur, like the murmur with high intensity is going to be seen in the middle of the systole and diastole. Okay, the junction of the systole and diastole. But anyway, the murmur is going to be seen during systole as well as diastole. Systole as well as diastole. So it's a systolo-diastolic murmur, or you can say continuous murmur. And the murmur, okay, it's also giving a sound like a machine. Okay, as if the machine is continuously working. Okay, so continuous machinery like murmur. Okay, continuous machinery like murmur. Where do we see such continuous machinery like murmurs? One condition which I want you to know, that is patent ductus arteriosus. Okay, patent ductus arteriosus. Now you will be having a doubt, sir, why in this condition called as a patent ductus arteriosus there is continuous machinery like murmur. Okay, let me tell you. First of all, what is PDA? Okay, patent ductus arteriosus is a abnormal connection between, let me show you. See, let us say these are the 4 chambers of the heart. Now, I am showing you the aorta in a different orientation. Okay, let us say here this is the aorta. From the left ventricle, the blood vessel that is coming out is the aorta. And what is this blood vessel that is going towards the lungs? This is the pulmonary trunk, which later divides into pulmonary arteries going to the both the lungs. Okay, here is the right ventricle, let us say. There is this abnormal connection between these two blood vessels. Okay, so this abnormal connection is called as a patent ductus arteriosus. Normally, during the intrauterine life, there is something called as a ductus arteriosus. This ductus arteriosus, what it's going to do? It is going to shunt the blood. It is going to shunt the blood, okay, from the right side of the heart to the left side. That is normal, okay. But if this ductus arteriosus, if it is persisting even after the birth, then it is called as a patent ductus arteriosus. Now, what happens if the patient is having patent ductus arteriosus? Let me tell you. See, this abnormal connection is going to cause the left to right shunting, okay, left to right shunting. So, the blood is going to shunt from the left side of the heart towards the right side of the heart. When during the systole or diastole, continuously, it does not matter whether it is a systole or diastole, continuously the blood is being shunted from the left side of the heart towards the right side of the heart. Why? Because already I have told you the right sided circuit is a low pressure circuit, okay, low pressure circuit. Maybe the pressures are going to be 25/10, that is systolic by diastolic blood pressure. The systolic pressure during the systolic pressure in the right side of the heart during the systole is 25 mmHg, and during the diastole the minimum amount of blood pressure that is maintained in the pulmonary circulation, let's say, is a 10 mmHg or 8 mmHg. So, that is a 25/10. But what about the blood pressures in the left side? Okay, the systemic blood pressure, that is 120/80. Systolo, diastolic. Okay, 120/80 we know. So, it does not matter whether it is a systole or a diastole, always the pressure in the left side of the circulation is always greater than the right side circulation. So, continuously there is going to be a left to right sided shunt. So, that is going to cause this abnormal sound, okay, even during the systole as well as diastole. Systole. So, that is why it is a continuous machinery like murmur seen with the patent ductus arteriosus. Now, such patent ductus arteriosus, is it going to happen right now in me? Right now, can I get the patent ductus arteriosus? No. So, patent ductus arteriosus is a congenital condition. Okay, it's a childhood condition. Okay, who is going to get this patent ductus arteriosus? Okay, the answer is the babies who are having congenital rubella syndrome. Okay, so the babies who are suffering with the congenital rubella syndrome, they will have this patent ductus arteriosus. Okay, if a mother contracts with the rubella, okay, if the mother gets the rubella while she is pregnant, the rubella can be transmitted, okay, transplacentally it can be transmitted to the baby, and it can lead to developmental abnormalities. That is called the congenital rubella syndrome, where the baby is going to have the cataracts in the eye, sensory neural deafness will be there, okay, heart related problems will be there. One of the heart related problem is a patent ductus arteriosus. Okay, so with this, what we have completed? We have completed the continuous machinery like murmur also. So, these are the murmurs which I want you to know for your exam. Again, I am telling you what are the murmurs. The murmurs are mainly classified into systolic murmurs and diastolic murmurs. The two examples of the systolic murmurs are holosystolic murmur or parasystolic murmur and crescendo-decrescendo murmur, also called as the ejection systolic murmur. Holosystolic murmur or pansystolic murmur are seen with MR-TR VSD, MR-TR VSD, mitral regurgitation, tricuspid regurgitation and ventricular septal defect. Crescendo-decrescendo murmur are seen with aortic stenosis, pulmonic stenosis, hypertrophic obstructive cardiomyopathy. Early decrescendo diastolic murmur is seen with the aortic regurgitation, pulmonic regurgitation. Continuous machinery like murmur is seen with the patent ductus arteriosus. Okay. After this, I want you to know some named murmurs. Okay. See in your exam, NEET PG exam or FMG exam, if you see this word, then you should be thinking about a murmur. Okay. Again, they will come in your medicine also, but I am trying to just giving you the hints. If you see this word, think about this condition. If you see this murmur, think about this condition. For example, if you see Carey-Coombs murmur, okay. So, this murmur called as a Carey-Coombs murmur, okay, it's a flow murmur. Carey-Coombs murmur is seen with which condition? The answer is acute rheumatic fever. We all know in a patient with acute rheumatic fever, there is going to be mitral regurgitation. Mitral always the most commonly affected. Mitral regurgitation followed by mitral stenosis. Chronic patients will have mitral stenosis. So, in a patient with the acute rheumatic fever, they can have a murmur called as a Carey-Coombs murmur. I am not going to the details what exactly is this Carey-Coombs murmur, but just remember for now. Okay, later you will get more explanation in the medicine. Austin-Flint murmur. Okay, where do we see this Austin-Flint murmur? A for A. Austin-Flint murmur is seen with the aortic regurgitation. Okay, aortic regurgitation. Now you will be having it out. Sir, I have studied that aortic regurgitation is going to cause early decrescendo diastolic murmur. Is it the same? Is it the early decrescendo diastolic murmur also called as the Auscultation murmur? No, both are different. Okay, both are different. That is early diastolic murmur. This is a mid diastolic murmur. Okay, Auscultation murmur is different. Next, what is this Gibson's murmur, which you already know? Okay, this is very simple. Gibson's murmur is nothing but the continuous machinery like murmur. Okay, continuous machinery like murmur seen with the patent ductus arteriosus. So, the same murmur is also having one more name, that is Gibson's murmur. Both are same. Okay. Next, Graham-Steele's murmur. Okay, where do we see this Graham-Steele's murmur? Graham-Steele's murmur is seen with the tricuspid regurgitation. Okay, so tricuspid regurgitation is going to cause the Graham-Steele's murmur. Next, for your exam, this Gallavadian phenomena is important. What is Gallavadian phenomena? Gallavadian phenomena is the radiation of the murmur towards the apex of the heart. Okay, the murmur is going to radiate towards the apex of the heart. Okay, seen with aortic stenosis. Okay, we already know in a patient with the aortic stenosis, there is going to be crescendo decrescendo murmur, but this murmur is going to radiate towards the apex of the heart. Okay, that is Gallavadian phenomena. So, these are some important named murmurs which I want you to know for your exam. In the recent exam also, they were asking about the tricuspid regurgitation. In a patient with the tricuspid regurgitation, there is going to be Graham-Steele's murmur. Next, what else you should know regarding the topic of these murmurs? See, all these murmurs, okay, the intensity of the murmurs and the duration of the murmurs, all this murmur intensity and duration will decrease. Okay, while you are auscultating, the intensity of the murmur and the duration of the murmur, okay, intensity means the loudness and the duration means the time component. They are going to decrease upon standing. Okay, when you stand, okay, from lying down position to standing position, when you go like this, and whenever you perform the Valsalva maneuver, okay, Valsalva maneuver, the murmur intensity actually decreases except in two conditions. So, right here, all murmurs decrease while performing Valsalva and standing except two murmurs. In which conditions? HOCM, that is the hypertrophic obstructive cardiomyopathy, this murmur, and mitral valve prolapse, this murmur. Okay, the murmurs which happens during the hypertrophic obstructive cardiomyopathy and mitral valve prolapse, these murmurs, they do not decrease upon standing and Valsalva. Students, please tell me, what is the murmur that is seen with the HOCM? It is the crescendo decrescendo murmur. We know crescendo decrescendo murmur seen with the HOCM. This murmur will not decrease. And students will automatically have it out. Sir, mitral valve prolapse, what kind of murmur is seen? You know, mitral valve prolapse, it is seen with the Marfan syndrome, a connective tissue disorder where the FBE1, the fibrillin 1 gene defect is seen, autosomal dominant disorder. So, in mitral valve prolapse, okay, let us say S1 and S2. The phase between S1 and S2 is what? Systole. The person is going to have mid-systolic clicks. If you see this word mid-systolic clicks, always think about mid-systolic clicks, always think about mitral valve prolapse. And the patient is going to have late systolic murmur. The murmur is going to be mid-systolic click with the late systolic murmur. So, except that is the reason why here see mid-systolic clicks with the late systolic murmur. So, these two murmurs, one is the crescendo decrescendo murmur that is seen with the hypertrophic obstructive cardiomyopathy and the late systolic murmur that is seen with the mitral valve prolapse, they do not decrease with standing or Valsalva. Okay, actually they will increase. Okay, why? What is the mechanism? Okay, that you will be like discussing in internal medicine, not here. Okay, next step, what else you should know in this area is the areas of auscultation. Okay, sir, where do we see this murmurs? Okay, where I can auscultate these murmurs? See, with your stethoscope, there are areas called as aortic area, mitral area, tricuspid area, pulmonic area. So, these are the areas where you can auscultate for these sounds. First of all, let me tell you what are the normal. Okay, normally, what are the areas? See, when you are auscultating on a patient, you cannot do random auscultation, right? You cannot keep the stethoscope here, here or somewhere. There are specific areas. See, this is right side of the body and here is the left side of the body, right and left side. And you know, here is the sternum. Here is the sternum. Now, right to the sternum, I am drawing imaginary line. This is just an imaginary line. So, this is called as right parasternal line. Para means what? Side. Sternal line, parasternal line. Now, look at here. This is the first intercostal spaces. The spaces between the ribs are called as the intercostal spaces. In the second intercostal space, see here I am keeping a point. So, this is the area to listen the aortic sounds, aortic valve sounds. So, this area is called as the aortic area. So, tell me where exactly the aortic area is located. The aortic area is located right side parasternal line, second intercostal space. Okay. So, right here this is aortic area, right side of the sternum, second intercostal space, parasternal line. Exactly opposite to it. See, now all other areas are located on the left side. See, all the other areas are located on the, all the points are located on the left side. So, exactly the second intercostal space, parasternal line, left side of the body, that is pulmonic area. Okay, pulmonic area. You can listen about the pulmonary valve abnormalities here, pulmonary regurgitation, pulmonary stenosis, those murmurs can be heard here. Okay, left side of the sternum, second intercostal space. Now, just down to it, in the third intercostal space, okay, this area which I am highlighting, the third intercostal space, this area is called as the Erb's point. Okay, Erb's point. Now, you tell me what exactly is Erb's point? Erb's point is also called as a neo-aortic area. Okay, neo-aortic area where you can again hear the aortic valve abnormalities, the splitting of the sound S1, S2, heart sounds splitting. Okay, the splitting of the heart sounds can also be heard here. So, now just down to it. Okay, here is the second intercostal space, this is the third and fourth intercostal space. Now, look at here, this is the fourth intercostal space, this is the area for tricuspid valve. Okay, that is the tricuspid area. So, where you can hear the sounds of the tricuspid valve. Now, you tell me what is this bone that I am highlighting? This is the collarbone, that is the clavicle. Now, in the middle of the clavicle, I am drawing an imaginary line. This is called as a mid-clavicular line. Okay, mid-clavicular line. In the fifth intercostal space, look here, this is the second, third, fourth, and this is the fifth intercostal space. Fifth intercostal space, mid-clavicular line. So, this area is mitral area. Okay, this is the mitral area. You can hear about the mitral stenosis murmurs, mitral regurgitation murmurs better in this area. Okay, that's almost the apex of the heart. Okay. So, now tell me, guys, what are the murmurs that are heard on the left side? What are the murmurs that areas that are located on the left side? All areas except the aortic area. Okay, aortic area is located on the right side. But if they ask about the Erb's point, which is the neo-aortic area, that is also located on the left side. Okay, how the question will be coming in your exam? See, they will be asking you to arrange, okay, the areas from the top to bottom. They will just try to know whether you know the order, okay, from the top to bottom or not. So, you tell me, arrange from top to bottom. Top to bottom on the left side, then it will be pulmonic area, Erb's point, tricuspid area and mitral area. You can remember it like PET M, okay, PET M, or like PTM you can remember, okay, the UPI that we use, okay, PTM. Okay, so pulmonic, Erb's point, tricuspid and mitral. These are the areas of auscultation. Okay, so with this successfully what we have completed? We have completed the normal heart sounds. Okay, previously I have explained you the normal heart sounds S1, S2, S3, S4. Okay, the normal heart sounds. Now here I have explained you the murmurs also. Okay, the murmurs, the systolic murmurs as well as the diastolic murmurs, the conditions which are associated with the systolic murmurs and diastolic murmurs, and also some important named murmurs I have explained you like Carey-Coombs murmurs, like Graham-Steele's murmur, Austin-Flint murmur. Okay, these murmurs, important murmurs I have explained you, and with the exceptions also. All the murmurs will decrease. Again I am telling you, all the murmurs will decrease upon standing and Valsalva except two murmurs, that is the HOCM murmur and mitral valve prolapse, which is seen with the Marfan syndrome. Okay, with this the topic is completed. Hope the video is helpful. Thank you.